Yes.
Analysis.
Clinical diagnosis means problem list. Problem list in nervous system includes which part of nervous system functions is disturbed. What are the different functions of nervous system? Regulation. Body control is again regulation. The different functions of nervous system. Who can tell me different functions of nervous system?
Balance.
Consciousness. So one of the problems could be loss of consciousness. What is the next step? The nervous system keep you conscious in the environment. Awareness. So the next part, loss of awareness. It could be one of the problem lists of the patient. What is the after consciousness and awareness? What is the next step? The function of nervous system. Response to motor system, which could be motor disorders. For example, paralysis or tremor or hypokinesia or disequilibrium imbalance. These are motor disorders. So motor disorders could include paralysis or paralysis or weakness, or it could be extrapyramidal disorder, which include, for example, hypokinesia means the speed of the motor function is decreased. It cannot move very fast. This is hypokinesia. Or imbalance, disequilibrium. So one part of problem list could be motor disorders. What else? What is the main function of nervous system? Appropriate response to a stimuli. For appropriate response to stimuli, first of all, nervous system keep you conscious and aware to environment. For what is the next step for appropriate response? The functions of your nervous system, what is it? After finishing the course neuroanatomy, neurophysiology,
Memory.
memory is a part of what as a whole? Okay, how you detect the stimulus? The detection of a stimuli is how we can detect the stimulus
Attention.
before attention. For example, how I can understand, detect this light, how I can detect any danger happens. Detection, for example, how I can see you. Can you understand my question? What are the main functions of nervous system? Can you translate it to your friends? What are the main functions of nervous system? Can you translate it in Arabic?
الوظيفة الأساسية للجهاز العصبي.
Okay, you know what is nervous system. So what are the functions of nervous system? Okay, consciousness, awareness, motor, what else?
Control
The
another
body.
system. Yes.
Okay, that is regulation. Okay, others.
Balance.
Of nervous system problem is impairment of sensation, like sensory loss and the other is analysis of information, which we call it cognitive impairment, and psychological impairment, psychological problem. So, this is because after the classes you don't study. You will have problem. Your main major of OT is nervous system disorders. If you don't understand neurology, because I have presented in simplest way, you cannot find how simple it is. This is the only way that I will give you very difficult questions that you repeat the course. The only way is that.
So
you don't study after the class.
It's a long time between class, doctor.
Okay, you should study. Okay, long time after this course, for a long time, for 10 years you want to work. Okay, this class is once and finish. You should study, and it doesn't mean that you should memorize. You should understand. If you understand anytime after, because of not studying after the class. How many of you after the class study? Neurology is very important course, because I know that some other professor taught you and they said that this course, these topics is very difficult and it is not suitable for OT students. I agreed, and I said that okay, I will modulate this part, but I won't do that. I will let that professor give you any question he wants, because your course should be repeated. It is very, very dangerous that you don't understand neurology, because I told it is impossible to tell in more simple way. It is impossible. That I ask you how we detect the stimulus, you don't understand sensation, understanding the role of sensation in your field is very important. I told you, okay, how you should respond to the stimulus. First you should detect it. How you detect it? Sensation. This is very easy question. Okay, maybe still your mind, your mentality is not still warm. So the first step, it is very important to understand, is clinical diagnosis. Clinical diagnosis means the problems of the patient. The problems, how you can understand the problem, you should know the main functions of nervous system, then you will have some problem in these functions, including consciousness, awareness, cognition, psych, and motor. These are the main functions of nervous system, and in clinical diagnosis you should detect, you should collect any problem in any of these fields which is due to disturbance in nervous system. After clinical diagnosis, this is the process of patient. We call it clinical processing. What you do in your clinic for the patient. The second part of clinical processing after this list, okay, my patient has problem in his motor system, has problem in his sensory system, has problem in his cognitive system, has problem in consciousness system, has problem in awareness. The next step, you should be able to, based on your neuroanatomy and neurophysiology science, you should be able to localize, okay, which part of nervous system is involved. As a summary, for example, when the patient has loss of consciousness, the problem could be in ascending reticular formation in brainstem or in bilateral cerebral cortices. This is what we discussed. When the patient has problem in awareness, the problem is in disseminated cerebral cortices problem. when the patient has problem in sensation, you should understand the problem could be from the receptors till cerebral sensory cortices. When the patient has problem in cognition, for example, the limbic system could be disturbed based on which part of cognition. The problem is in memory, the problem is in language, the problem is in attention, the problem is in learning, the problem is in social cognition, the problem is in executive function. Based on any part, mostly limbic system is responsible for information processing. And during information processing also your emotions and feelings forms. And the last part for response, motor system is responsible for motor response. But motor system is formed by primary motor cortex, pyramidal tracts, peripheral nerve, till muscle. This is any problem in this pathway leads to weakness. But in addition to movement, two other systems is responsible for coordination of the movement. Basal ganglia and cerebellum, and also sensory system also responsible in controlling movement. Also cognitive system is responsible for controlling this movement. These are the functions of nervous system. So based on which problems you have, you should be able to localize which part of nervous system is impaired. For example, sensory system, consciousness system, cognitive system, motor system, pyramidal system or extrapyramidal system, or equilibrium or balance system, in conclusion with cerebellum and sensory system for balancing. These are what we talked in details during neuroanatomy, neurophysiology, and nervous system disorders. So this is not something, for example, memorizing. If I ask you what is the main function of nervous system after 20 years, you say that I forgot for more than 20 years. It means that what is the function of gastrointestinal system preparing food for the body? If I ask you after 20 years, I forgot what is the function of gastrointestinal system. What is the function of respiratory system preparing oxygen? Okay, after 10 years, when you say that what is the function of respiratory system, is that you haven't understand, you just memorize. So the main function of nervous system is appropriate response to stimuli. Very easy, very understandable, not for memorizing. Understanding what is the function of nervous system, appropriate response to stimuli. Even regulation is appropriate response to stimuli of different organs. For what? Keeping the homeostasis of the body. That's it. So for this appropriate response, nervous system keep you conscious and aware for detection of the stimulus and analyzing the stimulus and appropriate response. So if you want to list the problem list of a patient, you should see that in which domains of nervous system functions you have problem. Consciousness, awareness, sensation, cognition, sight, or motor. So you should list. And it is very important that after that you should be able to localize, and the final and the most important step is etiology. Okay, which etiology disturb the nervous system function? This is the third stage. Okay, you have weakness. This weakness is because of involvement of pyramidal system, but because of a stroke. Let me tell you something that is very important, especially in psychological problem. For example, the patient is depressed. Depression is a clinical diagnosis. Depression is problem in psychological problem. But this depression is because of problem in limbic system, could be due to a stroke, could be due to tumor, could be due to neurodegenerative disorders. So these are 3 steps of diagnosis. Don't think that, okay, the patient is depressed and your clinical processing is finished. No. When a patient is 60 years old and he is depressed, this depression could be due to tumor. I had a lot of patients that was depressed. The only symptom, the only problem was depression, and this depression was because of tumor, was because of Alzheimer's disease. So you should be able to differentiate between clinical diagnosis, localization, and etiology. The patient has some problem in basal ganglia system, dyskinesia. This could be because of a stroke, obstruction of vessels, or could be due to neurodegenerative disorders like Parkinson's disease. Differentiation between different etiologies is important for planning special strategy for treatment. This is very important. Don't think that the problem is basal ganglia because of Parkinson's disease. It's the same as problem because of a stroke in basal ganglia. Different strategies. So, this is the first step in your mind, that for any clinical processing in neurology course, you should learn clinical processing. What is clinical processing? A good history and physical and neurological examination. First, clinical diagnosis. Clinical diagnosis should include any problem in consciousness, awareness, sensation, cognition and psych, and motor system. Any problem in this field, you should ask, you should see, you should evaluate, you should assess. Then you should again evaluate that, okay, which part of nervous system is involved. If you have some problem in motor, the problem could be in primary motor cortex, the problem could be in spinal cord, the problem could be in peripheral nerve, the problem could be in muscles. We should be able to which part. Problem in muscles leads to weakness, problem in the brain also leads to weakness. How you can differentiate between which part is involved? Again, because of imbalance, disequilibrium, this is a motor problem. In cerebellar problem, you don't have any weakness, but you will have problem in motor response. How? Because cerebellum is responsible for balancing of the movement. When you have imbalance, you will deviate from the direct way. This is the function of cerebellum. When the patient has problem in motor, which part? In balance, so you can localize cerebellum is involved. This is the neurological clinical processing. But the last step, what is the etiology? Which pathogen what has disturbed the normal functioning of cerebellum? What has disturbed the normal functioning of basal ganglia? What has disturbed the normal functioning of primary motor cortex? What has disturbed the normal functioning of the muscle? What has disturbed the normal functioning of cognitive system? What has disturbed the normal functioning of sensation? Okay, different etiologies we have, and what is the classification of these etiologies? First, some functional problem without a structural change. Okay, you are depressed because you have lost the normal functioning of limbic system, but you don't have any neuronal loss. You don't have any structural change. By some interventions, you can return back the normal functioning of that system. The second, which you have a structural change. A structure is changed, neuronal loss, and this structural change includes neurodevelopmental, and destructive. What is neurodevelopmental? During growing of nervous system, you have some interruptions. During the development of nervous system, you have some interruption. These neurodevelopmental disorders includes autism, includes ADHD and autism is a type of structural disorders. It's a type of structural disorders. It means that in autistic patient, when the nervous system grows from embryonic period till after birth till maturation of nervous system, some interruption happens. We will have some changes in the structure of nervous system. The nervous system does not work normally. But in destructive, when the maturation and formation and development of nervous system is completed, after that some pathogens destroy the normal structure. So, what types of destructive etiologies you know? I mean that which etiologies could ruin, could destroy? Like disability is the symptom you have. For example, weakness. Weakness is a problem. But what pathogen causes disability?
Fracture?
Like fracture. Fracture is a type of what? Because fracture, when you use fracture is problem in the bone. We are talking about nervous system. What leads to fracture? What do we call it as a totally?
Trauma.
Trauma. For example, one of the etiologies which can disturb the function of nervous system is trauma. What else? The other etiologies that could disturb, for example, the function of cerebellum, the function of muscle, the function of a stroke. What we call it vascular problem. A stroke, which I will talk about that because a lot of patients which are referred to you, two main problems. One is dementia, which we talked in the past session. The other is a stroke, which we will talk today. Vascular disorders, because all the functions of nervous system depends on blood perfusion, and when any problem in blood perfusion, oxygen and foods could not reach to neurons, and it will lead to problem in nervous system. What else? What other etiologies can disturb? Just think. The other etiologies can disturb the normal functioning of some parts of your nervous system, which leads to weakness, leads to sensory loss, leads to cognitive disorder, leads to
lost care.
Parkinson is a type of neurodegenerative disorders. Yes, Parkinson is etiology, but as a whole, neurodegeneration. Neurodegeneration means you will have some neuronal loss in some parts of your nervous system. For example, Parkinson disease, this neuronal loss happens in basal ganglia. What else? Infection. Do you know what is infection?
Inflammation.
Some types of inflammation or immune system diseases. Inflammation and immune system means the immune system attacks to some parts of your body. Tumors. For example, inflammation, MS, multiple sclerosis, immune system attacks to myelin sheath, and myelin sheath is destroyed, is weaned. So, for example, you will have demyelination in primary motor cortex. You will have weakness. What else?
Toxic disorders like
Very good. Toxins. Some toxins could disturb the normal function. Metabolic disorders, because for normal function of nervous system you need thyroid function. Hypothyroidism, hyperthyroidism leads to destruction of nervous system. So you have 3 steps. You have 3 steps. First, this is very important, very important. This is the last time. I won't add any, please. If you send us a message, my mark is 9.5. Please add half mark to us. In that way we will pass. No, none of you are eligible for passing. None of you. Because I killed myself that this part is very important. I don't know what are you discussing about. Neurology is very important in your field. You should be a professional neurologist. If you are not a professional neurologist, this course should be repeated for you. Should be. But you haven't still feel this importance. So, the first step for contacting with a patient with nervous system disease, first of all, you should collect, you should list the problems of the patient. These problems include any disturbance in consciousness, any disturbance in awareness, any disturbance in cognition, any disturbance in motor function. So, after that, you should be able to localize which part of nervous system is involved, which part of brain, which part of spinal cord, which part of peripheral nerves, which part of muscles, and which etiology destroyed or disturbed the normal function. It could be because of some trauma, it could be because of some vascular damage, it could be because of some types of neurodegeneration, it could be because of some infectious etiologies, it could be because of inflammation, it could be because of tumor, it could be because of toxins, it could be because of some metabolic problems, and also some hereditary or genetic problems. Some genetic problem leads to destruction of some parts of the body. If this genetic problem happens during neurodevelopmental period, leads to neurodevelopmental disorders like Down syndrome, a lot of autism, a lot of ADHD, a lot of neurological disorders could be due to genetic disorders that during the maturation of nervous system we will have some disruption. But when genetic problems shows itself after maturation of nervous system, it considered as a destructive. We have some genetic Alzheimer's diseases. Means after 30 years old, after 40 years old, this genetic problem show itself. In this level, we doesn't call it a neurodevelopmental disorder. Neurodevelopmental disorder should happen during the first 5 years of age. But don't think that genetic disorders show themselves just in the first years. No. For example, even Duchenne. Duchenne is a type of muscular dystrophy. It's genetic. And after maturation and formation of the muscles, the muscle fibers starts destroying, starts ruining, starts destruction because of some genetic gaps, some genetic problems. So if genetic problems shows itself at neurodevelopmental period, leads to some neurodevelopmental disorders. But if they happen after neurodevelopmental period, it is a type of destruction. This is the summary of neurology, nervous system disorders. Now, we should talk about some special types of etiologies which destroy some parts of nervous system and leads to some signs and symptoms or problems for the patient, and could lead to some disabilities in daily living activities, academic activities, school activities, communication and social activities, and job and professional and occupational activities, which in conclusion we call it performance. So remember, the patient who comes to you, just talk about their disabilities. I have problem in my job. I have problem in my daily living activity. I have problem in my school activity. I have problem in my communication. This is the first. Then you should see, okay, which problems related to nervous system leads to disability. It is because of loss of awareness, it is because of loss of sensation, it is because of loss of cognition, it is because of psychological problem, it is because of loss of motor function. And then, okay, which system in nervous system is disturbed? Motor system, cognitive system, consciousness system, what? And which etiology? It is a neurodevelopmental disorder, it is because of tumor, it is because of trauma, it is because of a stroke, it is because of neurodegeneration, it is because of infection, it is because of inflammation. This is the next, and then based on these clinical processing, you should plan, okay, what you should do for the patient that leads to improvement of the performance. In the last step, you should see how much improvement you have made for your patient. In which level? Not at the level of cortex cerebellum. These are not important for your patient. At the level again of performance. How much improvement at the level of performance you have made for your patient. This is very important. So this is a summary of neurology. That's why I ask you to record this part. That if you understand, and these are not memorizing. after 10 years, because if you touch, you understand that, okay, nervous system is responsible for appropriate response to the stimuli, externally and internally. So for that, the nervous system is responsible for consciousness, awareness, detection of the stimulus, which we call it sensation, processing of the stimulus, which we call it cognition, and appropriate response, which we call it motor, in which part the patient has problem, and each of these functions is the function of which part of nervous system and which etiology made these problems, and how you can help the patient to compensate any defect in the normal performance of the patient happen. This is the summary. Now today I want to talk about one of the etiologies. So now you know that a stroke and vascular damage is etiology. Okay, so this stroke could lead to, if this vascular damage happens in ascending reticular formation, leads to consciousness impairment, loss of consciousness. If this vascular damage happens in sensory system, leads to sensory loss. If this vascular damage happens in cognitive system, leads to cognitive impairment or even dementia. When this cognitive damage happens in limbic system, leads to psychological problems. The only symptom of a stroke in medial temporal lobe, which amygdala is located, could be loss of emotion and depression without any other symptom. Don't think that when a patient is depressed, it's just because of social pressure. No, it could be because of a stroke. So it depends on in which part of nervous system a stroke has happened, we can have different problem lists. So we have some list of problem. A stroke is a type of etiology. If a stroke happens in motor system, leads to weakness. If a stroke happens in cerebellum, leads to imbalance. If a stroke happens in basal ganglia, you will have extrapyramidal symptoms. This is how you should understand. So, a stroke is a type of etiology, the third part. Based on the second part, which part of nervous system localization this stroke has happened, the first part, what signs and symptoms could happen for the patient. This is the process. But you should not learn from the third part to the first part. Never patient doesn't come to you, okay, if I have a stroke in cerebellum, what signs and symptoms happen to me? This never happens. What happens from the first part? The patient come to you with imbalance. You should be able to localize this problem in cerebellum, and you should be able to find the etiology and the reason of this problem. This is the process happens in the clinic, not from the reverse that, okay, my doctor, I have a stroke in my cerebellum, so what signs and symptoms do you expect I have? No, reversely happens. The patient comes to you with signs and symptoms. Again, I am repeating it a lot. Okay, loss of consciousness. Can we have some loss of consciousness because of a stroke? Yes. If a stroke happens in brainstem in ascending reticular formation, we will have loss of consciousness and even brain death because of that. Can we have sensory loss because of a stroke? Yes, because of infarction of the second nerve, which is, we call it optic nerve. Optic nerve, we have infarction of optic nerve. Optic nerve because of some vascular damage, which we call it a stroke of optic nerve. leads to blindness, loss of sensation. We have a stroke in occipital lobe, we will have some problems in vision. We have a stroke in thalamus, you will have hemisensory loss because the pathway of sensation passed through thalamus. You will have hemisensory loss. So based on which part of nervous system is damaged because of vascular perfusion loss, we will have different signs or symptoms. Semiology is very important word. What is semiology? Semiology means finding the signs and symptoms, problems. And why we use the word semiology means how these signs and symptoms can guide you to localization and etiologic diagnosis. This is semiology of a stroke. So, a stroke is a type of etiologic diagnosis in the third step. So, again, the patient comes to you with signs and symptoms, you should be able to localize and you should reach the diagnosis of the etiology of a stroke. The other etiologies, tumors. The other etiologies, infections. The other etiologies, inflammation. The other etiologies, trauma. But what is the main character? These are the new topics. Just I want you just think. What is the main character of signs and symptoms happens because of a stroke? Okay, what characters guide you? Okay, it could be because of a stroke.
Unbalance of time like this.
What?
Like unstructure of hand movement.
Some problems in hand movement. Okay. We have other etiologies that leads to hand moving problems.
Dementia.
What guide you? This weakness of the hand is because of the stroke. Because we have also discopathy in the neck leads to weakness of the hand. Even we have some entrapment of the nerve in carpal tunnel leads to weakness of the hand. What character of signs and symptoms guide you to diagnosis of a stroke? Loss of memory. If the stroke happens in hippocamp, also leads to loss of memory. But if the perfusion of just primary motor cortex, just you will have weakness, not other symptoms. For all types of hand weakness because of a stroke, you have memory loss? No. What time you have memory loss? When the stroke also involves hippocamp, temporal. But you have a stroke just in frontal lobe in primary motor cortex. The only symptom is the weakness of the right side of your part, of your body. But what is the main character of vascular damages? How is okay? This could be because of the stroke. See, also if the stroke involves Broca system, also you will have aphasia. You will have problem in speech. But
I think it is
hair,
function for hands.
okay. How? You have lost the motor function of the hand. We call it weakness. As I mentioned, weakness is a symptom. This weakness could be because of problem in the brain. Exactly. In a stroke, the patient says that this problem happens suddenly, very fast. My hand was working normally, suddenly I lost it. Don't think that it is very easy. No. When the patient comes to that, he say that my hand is progressively weakened. It could be because of tumor. So, the main character of a stroke, which is losing normal functioning of some parts of nervous system because of vascular damage, is sudden onset. Very important.
How I know it is suddenly?
You should ask. You should ask from the patient. If the patient cannot explain, you should ask from a accompanied person. That's why I told you, see, we have a lot of etiologies that could involve nervous system. Don't think that all the symptoms is because of stroke. No, tumor should be ruled out. Infections should be ruled out. Inflammation should be ruled out. Why? Because the strategic plan and prognosis of treatment in these different etiologies is different. Even the strategies could be different. So it shows that taking history is one of the most steps in your treatment plan. Again, reach to this point. You should ask. I had a lot of patients that they were diagnosed because of, for example, a stroke, but it was a tumor. The doctor missed the patient, and after a while the patient died. So remember, again, we have a problem list. The problem list is a weakness. We have a localization. Okay, primary motor cortex. But the next step, what is the etiology? And finding this etiology is very important. And now we want to talk about one of the etiologies. So this etiology, a stroke, could lead to loss of consciousness, could lead to loss of awareness, could lead to loss of sensation, could lead to cognitive impairment, could lead to motor dysfunction. So remember, this is the semiology. But whenever any of these symptoms happens suddenly, you should think about a stroke. Okay. So, definition of a stroke. First, step by step. This is what we call a semiology. Semiology means during taking history and clinical examination, neurological examination, you could reach to etiologic diagnosis. Acute neurological deficit. What is neurological deficit? Loss of consciousness, loss of awareness, sensory loss, cognitive impairment, motor dysfunction. This is what we call it, neurological deficit. Acute. Acute means sudden. Acute means sudden. With vascular cause. Vasculature is responsible for sending oxygen and nutrients to the neurons. You know that brain neurons, the only nutrient for them is glucose. So when you have some vascular damage that stops normal blood perfusion and normal oxygen and glucose supplying to the neurons, you will have a stroke. But this is a rule. For diagnosis of a stroke, the symptoms should last more than 24 hours. Why? Let me tell you something. Any question? No? So, remember that any destructive cause, including vascular damage, including metabolic disorders, even trauma, if you can control the situation before death of neurons, these problems could be reversible. It means that, okay, the vasculature is disrupted, the blood perfusion is stopped. But if you can reperfuse this blood to damaged area less than 6 hours, the function of neurons will be reversible. It means that we have a golden time between starting the etiology till death of the neurons. So for diagnosis of a stroke, we have a rule that we call a stroke when the symptoms last more than 24 hours. This is one. And the other, how vascular damage could happen? We have two types. First is obstruction of the vessels. The other, how blood perfusion could be stopped. Just obstruction of the vessels, or what? What is a stroke? Acute, sudden neurological deficit because of vascular cause. But vascular cause has two types. First, obstruction. Do you know what is obstruction? And Sadat.
جلطة.
Yes?
جلطة صحيح.
Obstruction of the vessels. But the other type, that the perfusion to the neurons have answer. No, just about vasculature. See, a stroke is because of some vascular damage that stops perfusion of oxygen and. No, I am not talking about different causes which leads to a vascular damage. We have two types of vascular damage. First, obstruction. The second, rupture. Do you know what is the meaning of rupture? So we have two types of vascular ischemic obstruction. Is closed. The vasculature is closed. So the blood perfusion is stopped. But the other type is rupture. The vessel is ruptured. So again blood perfusion has problem. But we call it hemorrhagic. Do you know what is the meaning of hemorrhagic? Bleeding. When the vessel is ruptured, you will have bleeding. Okay. I think you need a rest. So we have two types of vascular damage. First, obstruction in the blood vessel and rupture of blood vessel. It is rupture. So the perfusion to the neural tissues is stopped. You have bleeding here. When you have bleeding, the blood doesn't go to forward tissues. So you have two types of a stroke. First, because of obstruction, which we call it ischemic stroke. The other type is because of rupture of the vessels, which we call it hemorrhagic, because we have bleeding. So, next session, after a while, I will talk about